Morning, Ban. My name is Camilo Gilabert. I'm the treating physiotherapy today to my patient Samantha O'Derry. She is a 44 years old female and comes straight to my clinic complaining of right ankle pain that started 3 days ago. There is no imaging, no medical review, and there is no significant history, and she loves to run. That's all the info that I got from the notes. Since this is a really low information case, I would like to dig in about the mechanism of injury, the zone of or the site of the pain, the level of pain that she's complaining of, if she was able to walk straight away or she had to limp, what was the initial management, if there is any use of painkillers and what sort of painkillers did she had, what is the 24-hour pattern in regards to pain, and what is her overall mobility status since the injury, what is the gait pattern, what are the coping mechanisms, and what sort of jobs jobs job he has, and what are her hobbies. Sorry. So I would like to also know what is her home setting in terms of if there is any stairs or number of floors or levels, and how is she coping with the activities of daily life. I will also would like to know if there is any previous injury, and yeah, I will complete my thorough objective assessment to rule in and out some different sources of ankle pain. To keep in mind, ankle sprain is one of those. High ankle sprain, ankle fracture, Achilles tendinopathy, calcaneum bursitis, plantar fasciitis, and any sort of tendinopathy on the dorsiflexors, reversors, and inversors. Um, I would like to assess sensation, proprioception, manual muscle testing, active range of motion, passive range of motion, and her overall mobility. So to further assess my patient, I would like to bring with me my numeric rating pain scale, my metric tape, if there is any need of assessing inflammation or edema, and in terms of probably offloading that extremity, I would like to bring with me two crutches just in case. Knock knock. I'm gonna wash my hands. Good morning, Samantha Dairy.
Hi.
Hi, Samantha. My name is Camilo Gilabert. I'm
Nice
the
to meet you.
yeah, I'm the treating physiotherapy. How are you?
Good.
That's great, Samantha. Sorry. Do you mind if I have a seat here?
Go for it.
Sure, thank you. So, Samantha, I just want to know that I'm with the right patient. Would you mind telling me your full name, date of birth, and age, please?
I'm Samantha Derry. I'm 44 years old. And my date of birth is 13 of like activities right now.
All right, that's great. So, thanks, Samantha. As you can see here, this is an excellent situation for me. That is made to assess, or is that all right for you, them to be here? They will be assessing me.
Yeah, that's all good. Yeah.
That's all good? That's great. So, Samantha, I know you are 44. You came because your right ankle is painful, and that happened 3 days ago. Started 3 days ago. So yeah, I know that you love running. That's everything that I got on your history. So would you mind telling me what brings you today here?
Right. Yeah. So over the weekend on Sunday, I was with the kids in the field. They was like playing soccer, so I have to like run after like to pick up one of them, and like suddenly I just
Twist your ankle.
I twist my ankle. Yes.
Please.
Yeah, it was so painful, and after that, I couldn't really walk much.
All right. So how did you end up walking or getting back home?
I just like I fall, like kind of like sit straight away and like see if I can move. It was so painful. So I have my husband who was like helping me to just like find a place to rest, but I couldn't drive or like no. I feel like I was in so much pain.
Yeah, for sure.
Yeah.
Were you able to walk right after, like weight bear on that leg, or
Oh,
you were not
not
able?
really. No, no. I was like holding him and trying to don't put like weight on the.
All right. So you were basically limping.
Yes, like I mean, I was trying to jump at the first because I don't really want to put that pressure in there because it was too painful. But yeah, then after at home, I took like some um, Panadol for the pain, and I start to feel a little bit better. So I'm just limping now. Yeah.
Sure. The pain has changed or still basically the same since injury? How would you say
It's
it is?
been better because I'm taking this medicine.
Alright.
But yeah, still like a lot. Like I would
A
say
lot of
like
pain.
6 or 7 out of 10.
Alright. So just to know, Samantha, don't take me wrong, why did you didn't go to the GP or to the emergency department and you decided to come to the physio? Just to know.
Because I know like you guys can see like first, like here.
Alright, fair enough, Samantha. Just to have an idea, no worries.
Just because I want like someone to see me as soon as possible, and like sometimes GP just send you like it's like
Yeah, it's
at
like
the end I'm gonna
a big
end
loop.
yeah, at the end I'm gonna end the physio anyway.
Easy, easy. So I know you don't have any imaging done, so I would like to get ahead and assess properly your ankle to see if there is any needing of any image. Alright? So, what apart from Panadol, what did you do like straight away after the injury? You went back home and then what did you do?
I put some ice.
Alright?
And I try to just leave it like here, like over a chair.
Alright, so you were, with the feet or the leg like
kind of elevation.
kind of elevated. Alright. Anything else that you did?
Not really. No.
Alright, so what would you say the pain is first thing in the morning? Like as soon as you wake up, the pain is always there when you're resting?
Yes, like if I'm not moving it, it feels fine. But as soon as like, if I move just like up and down, it's like manageable, like maybe 3 out of 10, but I'm trying to don't move it too far.
That's good. I know that you are already aware of the numeric rating pain scale. Anyway, I brought it here so you can have a look from 0 to 10, where a 0 is not pain at all, like nothing of pain, and 10 is like the worst pain that you could ever imagine. So how would you rate your pain when you're not moving, when you're resting?
I would say like 1.
Alright.
Maybe 0 when I'm not moving.
Alright, fair enough. And then what sort of things aggravates your pain?
Or if I try to move it like inside, it feels like I'm not doing it actually.
Like if you have your feet like that and you try to do like it's so painful. Alright, and what about going to outwards?
Yeah, like a little bit also, but I'm trying to don't do that much, and because
And how about the pain goes? Like what number would you say the pain is when it's so painful?
Like when I walk, it feels very uncomfortable, like maybe 6 or 7.
Alright, fair enough. What about weight bearing? Have you tried to put some weight on that leg?
Yeah, like this is why it's when it gets like 7.
7. 7 out of 10.
Yeah.
Easy. So, what sort of things alleviates your pain?
Just not moving it and like kind of rest.
Alright.
But still like so swelling, and like I have a bruise on outside, so yeah.
Did you keep using ice during these days?
Yes, I've been using it. Yeah. Like sometimes when I feel pain, like I use it.
Can I know how do you use the pain? You put your ice pack or straight away ice? How do you do that?
I put the gels, like I have some of them.
Yeah, the ice pack.
Ice pack, and I put it like, I don't know, like 10 minutes.
Easy.
That's
super good.
Yeah.
Beautiful. So that's the good way to do it. You're doing right. So yeah. So Samantha, I think that I have a really good idea what's going on. Could be probably likely it is an ankle sprain, or if there is any signs of fracture, I will be looking for that. Apart from the side of the ankle, is there any place that hurts? Like I don't know, the sole, all the heel,
No,
or the back of the ankle. Does it hurt?
Not really. No.
Alright, great. So Samantha, I know you love running. Is there anything else that you love to do and you're not being able to do now?
Just walk. Normally, I usually go for a walk with my dog. I'm trying to do as not much these days.
Yeah, for sure.
I hope to be back and like not have any like um I don't know any condition related with this like
Yeah,
because yeah.
I know. So, are you working at the moment,
Yes,
Samantha?
yes I am.
All right. What is your job?
I'm an accountant.
All right.
I'm an accountant, so like I tell them that I'm not very good at working, so like I'm just doing homework for
Oh,
this week.
and you are happy with it, and they are happy with it. You're coping well
Yes,
with
like
that.
I can do that like this week. I hope like next week I can be back. We will see.
All right.
I can
Let's
make
let's
it.
find out what's going on.
Yeah.
I know you live with your husband and your kids.
Yes.
Is that correct? How many kids you have?
Have two.
And how old are they?
Like one of them is like 5. This is the
Oh,
one that
lot
I
of
was like
work.
running.
Lot of work with that one,
Yeah.
I bet you. And the other one?
And the other one is 14.
So he's a bit
Yeah,
older.
he's helping me. I mean, he's
For
been very
sure.
like kind of like
Very supportive.
Yeah, he's in that age, but it's alright. It's
I
alright.
know.
Yeah.
That's alright, Samantha. So, do you live in a single story house, a double story house?
Double story house.
Alright, so you have steps to the second floor?
Yes.
And how many stairs are there?
Maybe like 15.
15, alright. And do you have rails into the house?
Yes, like once I have like something to hold. Yeah.
On the right side? On the
Yeah.
left side?
At the moment, I like going up just by sitting and trying to like use my left side.
The left side to push you
Yeah.
up and push you down, like whenever you go down, you do the
I
same?
kind of I'm trying to do that.
Alright.
Same thing.
We will have a look because it's not fully safe. I mean it is safe, but the best thing to do is have rails in both sides.
Yeah.
So we will find that maybe it would be a good idea to think about getting involved an occupational therapist to assess your house, and I don't know if you want, maybe give it a shot to try to assess properly your house, if there is any safety issue, and address that by the occupational therapist. I don't know, if it's something that you could think about.
Yeah, I mean.
Let's find out first what's going on with your uncle, and then we can have further thoughts about it. What about the way into your house? Do you have any steps or ladders there, or stairs?
Just one little one. It's not a big deal.
Not a
Yeah,
big deal.
I can do it. Yeah.
So, all right. And do you have any rails?
No, no.
And how are you managing to navigate?
Like that step, like because it's like next to the door, so I'm like holding the door, like.
All right. So it's easy to
Yeah, if I put
navigate
the other
that.
foot, it's not too bad. Yeah, because it's just one step.
All right. Anyway, I would like to get the occupational therapist involved, just to because there is two sides, and you certainly have to navigate those steps to get in and out of your house. So I will be more than happy to involve the occupational therapist, and he would be able to assess any safety issue and address that with you. All right?
Right.
Sounds
Yeah.
good to you?
Mhm.
Okay. Easy, Samantha. Let's get back a little bit about your overall health. Do you have any medical conditions that you're aware of?
No.
Do you take any regular medications?
No, no.
Do you smoke?
Sometimes, like rarely, like I would say, like I don't know, maybe twice a month.
Alright, so it's really
like
little.
social, yeah.
Yeah, for
sometimes.
sure. And have you ever thought about quitting smoking? Because you're 24, you have kids, there's plenty of life ahead of you, and with any injury, the best thing to do is stay away of smoking. So I know it's sometimes hard, but
Yeah, like I would say that I'm not addicted to smokes. It's just I do it sometimes when it's like socially. So it's like
yeah.
yeah.
I know it's
why not?
very little, but if you ever think about getting completely out of smoking, there is a lot of resources available out there. All right, so you can come back to me and we can work together on that.
Yeah. Okay.
All right.
Yeah.
Easy. And what about alcohol? Do you drink alcohol? If you don't mind me asking, because I know this
Yeah.
is my duty of
Well,
care.
same thing. Just when I go out, just like sometimes with friends, we have like a glass of wine, something like
Easy.
that.
I'm happy with that, Samantha. So keep that way. The best thing to do in terms of your rehab process is getting zero of smoking. I know
Mhm.
it's hard and you're already doing so little. So if you ever think about quitting smoking, let me know, right? I can refer you to some counseling or maybe to the nurse so we can engage you with any sort of help out there. And same with alcohol. You are doing great, so keep that way. All right?
Yep.
Easy. So Samantha, I think that I have pretty much all the information that I need.
Mhm.
I would like just to rule out a few things that will require further assessment. So, have you ever experienced any unremitting headaches, like very bad headaches?
No.
All right. Any problems with your vision
No.
or hearing problems, swallowing, taste?
No.
Not any problem with articulating your words, and
No.
any sudden weakness in any side of your body,
No.
any problems with your sensation in any side of your body?
No.
No. Any problems like with your bladder or bowels?
No.
Any chest pain, cough,
No.
any unremitting pain in any side of your body apart from the ankle?
No.
Any problems like heart condition, lung conditions,
No.
night sweats, chills or fever?
No.
That's great, Samantha. So,
Yep.
what do you expect from today's session, Samantha?
Well, to know if this is too bad, because I have a trip in 2 weeks' time,
All right. So, where are you
and
going, Samantha? If you don't mind me
I'm
asking.
going to Germany.
Oh, that's great. Are you
And
going by yourself?
yes, I mean with two friends, because we're trying to do a marathon, so in
Oh,
there. So
so you're booked for a marathon in 2 weeks' time?
yes.
All right. Ah, how do you feel about it?
Yeah, no, for sure. Like this is unexpected.
Yeah, for sure. Bad
So
timing, I think. Really bad timing.
yeah, but I think like maybe in 2 weeks' time I could be better. I don't know.
Yeah, let's find out what's going on with your heel.
Mhm.
But probably 2 weeks is a short time. Let's try to see what's going on there. But probably that marathon, it's something to think about, to discuss further a little bit later, right, during our session.
Okay.
So I know you want to go to Germany. You want to know what's going on in your ankle. So there is anything that you would like to add, like today's goal?
Well, hopefully know like what I can do to recover as quick as I can.
All right, fair enough.
I don't losing the hope to be able to run, but yeah, for sure now I cannot even weight bearing without pain. So
For sure, for sure.
maybe just the pain first thing, and then see if in 2 times a week, in 2 weeks time, I can
Go to the
deal
marathon, have your
better.
trip to Germany. All
I
right,
don't know, this going there, I don't know. Is everything already planned, all the bookings,
for
so
sure. Has to be everything planned.
I cannot cancel the trip at this point. I have my holidays already booked, so it's like, it's a
It's a
big,
big thing.
yeah,
All right. So apart from the marathon, how long are you gonna stay in Germany?
it's like 1 week.
A week. All right.
Yeah.
And probably you're going to visit all the places and walk a lot around.
Yeah, that's the idea. So
Yeah,
yeah,
for sure.
this is why I'm here as soon as possible too.
Easy, Samantha. Great. Um, I know that you are sitting there, but do you mind going here to the plane for me, please?
Sure.
Did you just before you? All right, that's all right. You already stood up, so that's fine. Um, how did you get to the clinic today?
My husband is waiting for me outside.
Oh, so he drove it. He drove you here.
Yes.
All right. So let's see what's going on here.
Okay.
All right. Easy. Do you mind if I put my hands on your
No,
legs?
go for it.
All right. So I'm just gonna pull up your pant. All right. Sorry. I know it hurts a lot, but yeah. Let's try to put something under Feels better there?
Yeah,
For sure.
Thank you.
So let me just have a quick look how your left leg looks like. And compared to this side, is anything else apart from the bruise, like any swelling?
Yeah, swelling and a little bit of bruise outside.
All right, outside of the ankle.
Mm-hmm.
All right, fair enough. It's mild swelling, very little.
It's a big swelling.
Big swelling, like little, mild.
Yeah.
Yeah. All right, fair enough. So there's not like a big ankle on that side. It's not a big.
It is.
It is. All right. So let me measure with my tape measure. All right. Just right off under the ankles. What is the measurement? Right. Let's say 10 centimeters. And what is it here? Like 12?
Yeah, 11.
All right, 11. So 10 here and 11 here.
Yeah.
All right. So it's really mild, not too big. There's not like any a big chunk of inflammation here. So that's great. If you can sit up for me, please, and show me where does it hurt.
It hurts here.
Okay, so this side.
Yeah.
All right. What about, does it hurt here?
No.
I would like just to rule out if there is any bone tenderness here. Just ruling out if there is any signs of fracture.
It's a little bit uncomfortable when you go close.
All right, but it's not like a sharp pain.
No.
All right, because if there is any fracture, the pain will tell you if you're gonna be ouch, you know?
Okay.
Not here?
No.
All right.
Feels
what about,
like, yeah, uncomfortable. But
what about here in the base of this
no.
bone? Not here, not here.
No.
All right. What about here?
No.
What about in the heel?
No.
No problems here. So I'm happy with this because it means that there is no signs of fracture.
Okay, that's
apart from the fact that you are not able to walk or bear weight on that leg, there is no signs of fracture.
Okay.
All right. I could see when you were standing that you were able to put just light weight on that leg, which means that that's okay. I will anyway be assessing your gait, but doesn't seem to any imaging to be done so far.
Okay.
All right.
That's not too bad.
Let's keep digging in to see what's going on. All right.
Yeah.
And then we will see if it's too bad. All right. Let's see the ligaments here. All right. Have you ever had any injury on this ankle before?
No.
Never? This is the first time that you got an injury?
First time.
All right. So I'm gonna hold your ankle and test for ligament instability here. This is one of the strongest ligament of the ankle, so I'm not expecting to find any problems there. But I would like to know probably those ligaments here are involved, so that's what I'm.
Oh yeah.
Yeah, hurts a lot.
Yeah.
All right.
Oh.
Would you say it's mild instability? What would you say it is?
Stability? What do you mean?
Instability. No, I'm asking like for my assessors.
Oh, okay. No, it's just like it's painful and.
But doesn't seem to really unstable.
Yeah, no.
All right. So we'll be assessing the anterior ligaments, posterior ligaments, and the middle ligaments. All right. Seems there is a pretty much signs of not signs of high ankle sprain, which is great.
If it's so stiff.
I know, it feels really stiff. But what about the pain here?
Yeah, no, it's not too bad. Actually, it kind of feels alright when you move it. Like,
Alright, so that relieves a little bit your pain.
Yeah.
Great. So,
it's a weird feeling.
what about here? How's the pain here?
Yeah, when you do that, I don't like it.
What bad? How bad is it? What number would you say it is?
I would say it's like 6 or 7.
Alright. What about here in neutral position? Same thing?
Yeah.
And what about with fully try to full dorsiflex.
As soon as you go like with your foot inside, it feels like so uncomfortable.
Yeah, for sure. Nothing here. On this side doesn't
Yeah, no,
hurt.
that feels better. Yeah.
Alright, fair enough. Would you mind putting your feet up for me? Alright. Great. Feet up for me, please. Good job. Push my hand. Push my hand. Yep. Now, try to take your little finger outside for me,
Right.
like so.
Yeah.
Yep, try to do it. Good job. Same thing with this one. Alright. Now, bring your foot inwards, like so. Okay, again, please. Good job. Same thing with this one, please. Alright. Is it because it's too painful
Yeah.
that you cannot do any further,
Yeah.
you know,
Yeah.
effort? So, whenever we have pain, the muscle get a little bit weak, you know, how can I say this? Inhibited. Alright? So
Okay.
that's why you will feel like less strength on this leg, especially
Yeah.
on the ankle. Alright? So bend your knee for me, please.
Like
Alright?
a protective mechanism.
Yeah, for sure, that's a protective mechanism. So now, what I want to do is test your quads. Alright? So strengthen your knee, please. Alright? And keep that way. Don't let me push you down. Don't let me push you down. And now pull. Don't let me pull you. Good job. Knee up for me, please. Don't let me pull you down. Don't let me pull you down. Don't let me pull you down. Ah, good job. Beautiful. Now, up for me, please. Don't let me push you. Good job. Push my hand. Good job. Now, extend knee extension. Bend a little bit. And now, don't let me push you back. Good job. Don't let me pull you now. Beautiful. Good job. Good job, Samantha. Yeah, I think that I need to see how are you walking and see if there is any need of offloading a little bit that leg and see what's going on. But what I think, Amanda, from my findings, from my assessment here, everything points to the direction that you got. You sustained an ankle sprain, lateral ankle sprain, and it's a grade, at least a grade 2. All right. Grade 2 ankle sprain. So grade 2 ankle sprain takes in average 6 to 8 weeks to heal. So what does it mean? That probably that trip in 2 weeks time is really soon to start running. And yeah, this is my advice on you. You will take your own decision, but this is my advice as a health professional. I think that you should not go on that race. You're still gonna be able to walk. You're still gonna be able to walk if we can put a boot there, so you can, you know, walk with no further problems or no get re-injured. All right, but we need to respect the healing times of the body. And what does it mean? Not put too much stress on that.
Okay.
All right. So what I'm trying to tell you is that walking is fine. Walking within the pain limits is fine, but not running. Running is not an option at this stage.
Okay.
All right.
How long?
That's what I told you. Between 6 to 8 weeks. Everybody is different. All the persons heals different.
So I'll be able to start to run again between 6 and 8.
Probably 6 weeks to 8 weeks. We can start looking at how your ankle is looking. How is the stability there? How is the pain in your exercises? And if everything goes alright, we can start thinking about jogging or a light jog.
Okay.
All right?
Yeah.
Sounds good to you?
Yeah.
Let's go. Let's go to the floor. I'm just gonna move quickly this. This is not part of the session. Just gaining some space. All right?
Do you want me to walk now?
For sure. Not run, but walk.
Okay.
All right. So I'm happy you are So you are able to put weight on that leg, so that confirms there is no need of any imaging. Okay?
Yeah.
Now, stand you over here, please.
Yeah.
All right. So, how bad is the pain when you are weight bearing there?
When I'm walking, maybe like 6,
All right.
and if I just stand, I feel like it's a bit less.
When you are putting weight there?
Now when I'm like standing, it's a
Yeah.
bit less, so it's like 4.
Okay. All right. Fair enough. So, um, yeah, I would like to see how are you walking back and forth, please. All right. Come back. All right. Easy. So, um, come back to the plate for me, please. So, first of all, I'm gonna start doing some exercises for your ankles. All right.
Yeah.
So, this information is really important. Movement in your ankle is okay. Is actually is good for you that you move your ankle. All right. So, but overexert that joint or overexert, meaning that the pain goes over the 5, is gonna produce more harm than benefits on you.
Okay.
All right. So whenever you are doing anything at home, especially with the younger, or when you are doing your household things or your daily duties, try to keep your pain levels just maximum out of 5. All right. If
Yeah.
you go over that, step back a little bit and try to do lighter duties.
Okay.
Make sense to you?
Yes.
All right. So, but movement is really good. I mean, keep yourself moving, keep yourself active, and try to weight bear on that leg is also really good.
Okay.
All right. Not go over the 5. Okay. So I'm gonna show you some exercises that I want you to do at home. Because this is just 3 days after surgery, I'm not pretending to do any
I didn't have surgery.
resistance. What was that? Sorry?
I didn't have any surgery.
Did I say surgery?
Yes.
Sorry, it's just 3 days after injury. I wanted to say, and because it was just 3 days after, I'm not putting any resistance on these muscles. All
Yeah.
right.
Okay.
But future session we will start putting some load on that exercises. So it's gonna be basically 3 exercises. The first one is gonna be up and down. The second one, we're gonna do it while we are standing here. The third one is gonna be rolling out your feet. All right.
Standing.
While you are sitting.
Okay.
And the third one is gonna be like so.
Right.
All right. You know what? I know that I have a really light TheraBand here. Is this a light TheraBand?
Yes.
All right. Let's pretend that I went to the lab and I got a TheraBand, because I think that I would like to see how do you feel doing this exercise with light resistance. All right. Sit down. How does it feel?
This movement is not too bad.
All right. So you're gonna count 10. Remember to keep so we can include the longer muscles here.
Right.
All right. So 10 times going down. You at home, if you don't have TheraBands, if you're not able to get them probably from the shops,
I think you're gonna give me one.
any cheap one. Yeah, maybe I can give you one. I have
Yeah.
spare ones. So yeah, if you are happy with it, I'm gonna give you like a really light light resistant TheraBand, and I want you to do this at home 10 times.
Yeah.
All right. Then try to keep here and put your feet over. Yeah, you have been doing this a couple of times, I think. All right. So now what are you gonna do is try to put your like the ankle out. All right, and with this leg you will give some resistance. All right, so you will feel that your muscles here are getting some work.
Yeah.
All right?
I can feel the ligament. 100%.
Yeah, for sure. For sure. I mean, we're not targeting the ligaments, we're targeting the tendons and the muscles here.
Okay.
All right? That's what we need 10 times.
Right.
All right?
So when I go inside, I can feel the pressure in that.
Yeah, it feels like stiff or feels the, you know, the stretching or...
It feels the stretching, yeah.
Yeah, for sure. For sure. 10?
Yeah.
Easy. Now, we're gonna do the same to this side. Let me show you how you're gonna do. Put your leg under. Same thing. This feet is going to give you the resistance, and then yeah, beautiful. Have you been in physio before? Probably.
Maybe.
Yeah, maybe. That's all right. Good. Okay. And the most important one is gonna be this one. So if you can scoop you forward a little bit so you can get to step onto this thing. Yeah. And then going up. Alright, this thing has to give you a little bit of resistance. Yeah. Up. How does it feel?
Not too bad.
Not too bad? That's great. Alright, so this is gonna be one set of dorsiflexion, plantar flexion, inversion and eversion exercises.
Yeah.
And the second thing that I want you to do at home is write your full name in the air with your feet. Alright? So what does it mean? You're gonna be Samantha. Alright? Samantha O'Derry, and you can write the names of all your family if you want.
Okay.
So until the third or fourth generation if you want.
Okay.
Alright?
Cool. Yep.
Makes sense to you?
Yep.
Let's keep doing at least 2 names. Let's think about the names of your kids and write them down on there for me. Alright? What is the name of the first one? The eldest one?
Michael.
Michael O'Derry.
Yeah.
Yeah. And the younger?
Louis.
Louis.
Yeah.
It's a beautiful name.
Yes.
Kind of Italian as well.
Louis.
Luis.
Yeah.
Is that a Spanish name?
No, Louis.
Luis.
Louis.
Luis. Luis.
It's a very common name.
Not really. Not in Australia.
It is.
It is?
Yes.
Oh, I'm surprised.
Louis.
What about Nadia? Do you know anybody that calls themselves Nadia?
Yeah, I'm in a couple of scenarios here.
Yeah, I think that there is a physio called Physio Nadia.
Nope.
Ah, cool. So, how is the pain level now?
Yeah, that's alright.
It's okay?
Feels like, yeah.
Alright, now I want you to do some circles with the ankle. Alright, 10 circles to the right. Alright, if you can strengthen your leg for me and then do
Like
this
this?
movement. Yeah, that's gonna be really good. So these are mobility exercises. The writing the name on the air and doing circles to the right and then circles to the left. It's gonna be the second mobility exercise.
Right.
Alright, so summarizing, the strengthening exercises, mobility exercises is gonna be one set. Alright? Make sense to you?
Yeah.
Alright, anyway, I will write them down for you and email them for you.
Yeah,
So you don't need to remember. But I want you to do this 3 times. So 3 sets of every exercise that I show you.
Yep.
At least 2 to 3 times a day.
Okay.
All right?
Yep.
Do you think you're able to do that?
Yeah. Easy.
All right, so that's gonna be really good in terms of getting back to your previous level of function.
Right.
All right.
Yep.
So yeah, let's get back. Sorry, not yet. You told me that you had to walk. So what I'm thinking, Samantha, is trying to offload a little bit that ankle because pain 6 out or 7 out of 10 is really high.
Yeah.
So what I want to do now is try to offload with one crutch. All right, and see how are you doing with one crutch.
Yeah.
And I'm thinking not use a boot now, but provide a boot for you like 2 or 3 sessions before your trip to Germany, because that way with the boot and yeah, it's gonna keep your heel safe while you're walking there.
So
I don't know if that sounds good for you.
I need to bring the boot to Germany.
Yes, for sure.
Oh, okay.
For sure, that's what I'm thinking, Samantha. Let's see how do you do with this crutch first. But I am thinking that because you are gonna walk like a lot there, and I don't want to stop you from walking and visiting all the places. And I already took off your marathon. So what about using a boot?
Yeah, but like, is it not the boot for fracture or like what is?
It is, but it's gonna keep your heel. I mean, it's not a boot. It's like a brace. Sorry, my mistake.
Ah, brace.
It's a brace.
Okay.
It's like a brace that holds the ankle, like gives some sort of stability.
Okay.
All right. So I know you're gonna have a walk and you're gonna walk a lot. So
Yeah.
I don't want to produce any harm because it's gonna be just 2 weeks after the injury. The ligaments is still healing. So that's gonna provide you with some stability. All right.
Right.
Plus the crutch, I think it's gonna be all right.
Okay.
But definitely you cannot run.
Okay. Yeah.
Make sense?
Yeah.
All right. So I'm gonna take this brace now for you, so we can use it straight away. So yeah, let me put this brace for you and show you how are you gonna walk. Let me know how does it goes for you in the next session. And also you're gonna use this crutch. Just one crutch. I don't want to take all the weight because you got your thing here. All right. So come on. All right. Get there, please. And I'm going to show you how to walk. All right. So first thing first, crutch goes straight with the right one, and the crutch needs to be here on the opposite side. Make sense? So crutch on right, and then the left step through. Good job, Samantha. How are you feeling?
It feels like.
How's the pain there?
Feels better, like 4.
Good job. All right,
For
get
how
back to
long
the
I need to
clean.
use this?
Sorry?
I need to go with this crutch to Germany.
Yep, that's what you're gonna have to do. Otherwise, your recovery is gonna be longer.
Okay.
All right. So, how's your level of pain now?
Like 4. 5.
Okay, now.
Yeah.
All right. Overall, having pain is something that is really expected after the session, after being moving around. But that pain shouldn't last longer than 24 hours.
Okay.
All right. I want you walking with this stick, with this crutch the whole time, and using that brace when you're gonna have a walk. Get the brace removed when you're doing your exercises.
Okay.
All right.
Yeah.
Any questions for me? Because today is Thursday. I wanna see you again on Monday. All right, and we're gonna have 2 sessions a week, and see how it goes.
Okay.
All right, and see what's gonna happen just before your trip to Germany.
Okay.
Make sense to you?
Yeah.
Any questions?
No.
See you next time. Thank you.